this 7th of April, and then we thought good morning to everybody. I hope you're all doing well, safe at home. So what we decided is to complete part 3 of our cancer management during COVID pandemic. So let's see, the other day we have discussed about the chemotherapy and how to do with these patients when they come to the hospital. Today what we are going to do is that we restrict ourselves to few points in surgery as well as radiation therapy, though the specialist will also let you know more in details. So let's come to the surgical patients. Now surgery we can divide up into three types. Those who need emergency surgeries right away, those who can wait for 1 or 2 weeks, and those which we can completely postpone. So let's take the emergency surgery. Suppose a patient comes with excessive hematemesis, blood in the vomit, blood in the cough, okay, excessive hematochezia, motion. So those are the emergency patients. Patients who comes with spinal cord compression, has to be operated. Patient which comes with the solitary, those are the patients where we can immediately have to address intestinal obstruction, perforation. These are the emergency surgeries which has to be addressed in spite of the COVID pandemic. Next, there is another set of patients where we can do the surgery a little later, like with the curative intent, which has, and where we can give for, there will be another set of people whom we can give for observation for some time and postpone it 1 or 2 weeks, like subacute obstruction, okay, any breast tumor which can be given. In those cases we can give the neoadjuvant chemotherapy or give some oral hormonal tablets, or anyhow radiation may not be possible, give something neoadjuvant to buy the time to push the surgery for a little later date. That's what has to be done. And any elective surgery by rule has to not to be performed at this point of time till the lockdown is over. So only addressed emergency surgeries. Let's look into radiation. Again, radiation falls into the same group. If it is curable, yes, give the priority. If it is not curable, and if it is palliative, you can postpone it for a couple of weeks. Just push it by giving some chemotherapy too. Some emergency radiotherapies has to be performed there and then only, for example, like spinal cord compression, brain tumor, bleeding, hemostatic radiotherapy, bleeding for vagina, bleeding for rectum. So those has to be done. Whereas any elective radiation, say breast radiotherapy, if somebody is already on a radiotherapy, please complete the radiotherapy, and if they are not on the radiotherapy, then okay, please give some other therapy so that we can push the definitive radiotherapy for a little later then. What we need to do is to prioritize. It is not fixed. We need to discuss with the patient, discuss with the local situation, follow the guidelines, and then take a call. So again, once again, today I sign off. Stay at home, stay safe. We need to tide over this pandemic.